Welcome to the Elder Care channel. I'm Liana Lopez with Horizon Elder Law. I'm here with Alan Hamm, a consultant specializing in healthcare and retirement issues, including how to plan for long-term care and how to navigate the Medicare maze. Alan is the author of the book, How to Plan for Long-Term Care. If you're interested in reading the book, you can contact Alan's office for a copy. Call 1-800-400-0577. Alan, before we get into the details of how you help people, can you share with us about yourself and how you got involved in helping people plan for long-term care?
Surely, Anna, I'll be happy to. I really got started in this business of helping people plan for long-term care because of a couple of family members that ended up needing care and really impacting our family. Particularly my grandfather was a very successful businessman. He developed Alzheimer's disease when he was about 73 years old, and he ended up losing his business because of this memory issue. And it impacted my parents in a big way. They had to delay their retirement. And we really found out that long-term care is a very complicated subject. It's not covered by most health insurance plans. And so people really need to take the issue seriously and deliberately decide how they'll plan ahead for a need for long-term care.
Absolutely, that's a very interesting story. So what type of services do you offer?
Well, we have a 7-step process that helps people determine their best option for planning for long-term care. There's really 4 ways to pay for long-term care. One way is to rely on a family member, which is what my grandfather ended up doing because it was really a default option. He didn't really plan ahead deliberately. The second option is to use the welfare program. That's a safety net for people in our country who have no other way of paying for long-term care. The third way to pay for care is to rely on your assets to accumulate the money that you need to pay for care. And the fourth way to pay for long-term care is to purchase long-term care insurance. Our 7-step process really helps people determine which of those options is best for them and their family.
So what does your typical client look like?
Our clients are people who really care about their future, and they care a lot about not burdening their family. I mentioned earlier about my grandfather's situation. His Alzheimer's disease had a major impact on his children. And so people who plan ahead for long-term care want to make sure that their children are not burdened by their lack of planning. So again, we're looking at people who plan for their future. They want a bright future that's really carefree.
Absolutely. And to add to that, our attorney, Julie Fiedler at Horizon Elder Law, has obtained her policy of long-term care insurance through you. She agrees that it is our own responsibility to plan for our future. Why do you think most people lack a plan for long-term care?
Well, Leona, I think that the major reason is lack of awareness. I keep coming back to my grandfather's situation. He was a successful businessman, he was a planner, but he really had no idea that long-term care wasn't covered by his Medicare coverage. And so lack of awareness is probably the biggest reason why people don't plan for long-term care. But another major reason is lack of trust. Who do we go to for objective advice when it comes to planning for long-term care? Most of us are hearing from insurance agents, insurance companies, even government statistics that a lot of times are myths. And so they really don't know who to trust. And so, again, our process is designed to help them get the education that they need to learn about the issue, and then have a trusting process that they can go through to determine how they'll pay for this need.
So you mentioned the government and the Affordable Care Act or Medicare. Do they do anything to change how long-term care is paid for in the United States?
Well, that's a very good question. A lot of people believe that the government will cover long-term care, or that the new Affordable Care Act has some impact on how long-term care is paid for in our country. The answer to your question is really neither of those will pay for long-term care. They really cover what is known as short-term care. They'll cover care up to 100 days if you need care after a hospitalization. But getting back again to my grandfather's situation, if you develop a memory issue or need assistance because you've simply lived a long life, Medicare and the Affordable Care Act won't cover a dime of that.
And this explains how important it is to plan for our future in long-term care insurance. Thank you for your time, Alan, and your insight on this very complex topic. If you would like more information or to schedule a free consultation with Alan Hamm, You can reach him at 1-800-400-0577. You will find a link to his website and additional information about superior long-term care on the main elder care channel.